For a moment, try to think about your mental health the way you think about your physical health. We all have good days and bad days, and ups and downs in our physical health. This is totally normal. Some days you might feel a little tired, sore, or under the weather. That doesn't necessarily mean you're sick. You know you're physically sick when you notice that something has changed for the worse. You were feeling fine, but today you have a high temperature and you've lost your voice. Something prevents you from functioning properly. Things that are normally easy now feel a lot more difficult. Maybe it's even bad enough that you can't make it to school or work. Mental health problems are similar. Good days and bad days. Ups and downs. The difference is that instead of looking for physical symptoms like a runny nose or an upset stomach, you're looking at your thoughts, feelings, and behaviors. Here are some examples of things that might tip you off. You used to be really cheerful and outgoing, but lately all you want to do is sit in your room. Things you used to enjoy have lost their appeal. Food doesn't taste as good as it used to, and all your favorite music sounds boring. You're falling asleep in class or at work. It's hard to pay attention, study, and keep track of your assignments. Your friend is talking and you're trying hard to listen, but you can't concentrate. All you can think about are bad things that might happen to you. You're having thoughts of death, or of hurting yourself, or of killing yourself. You can't leave the house without organizing and aligning your shoes and clothes. You do this so much that it's making you late for school. You're always irritated, and you can't stop snapping at people. Recently, you started hearing voices that no one else seems to hear. Maybe just one of these applies to you, or none of them. The important thing is to notice any change in your thoughts, feelings, or behaviors that makes it harder for you to go about your daily life. Getting better. Before we go any further, it's important to remember that no matter what kind of mental health problem someone is facing, it is always possible to get better. Don't forget this. Finding help is important. Connecting with others is important. So is being kind to yourself and trying not to judge yourself too harshly. Do I need to put a label on it? Let's talk about labels, or what to call the different kinds of mental health problems. The label a mental health professional uses to talk about a specific mental health condition is called a diagnosis. An example of a diagnosis might be generalized anxiety disorder or bipolar disorder. There are a lot of diagnoses that describe different mental health conditions. They go way beyond just depression. Some people feel comforted to know that there's a name for what they've been experiencing. Other people don't like it. They might feel that the diagnosis is too medical and doesn't leave room for who they really are as a person. Both views are okay, and you can decide for yourself where you stand. This part of the book discusses the symptoms of the most common mental health conditions, but keep this in mind. You don't need a diagnosis to get help. Some therapists actually prefer not to diagnose their clients. And even people without a diagnosis or even a serious mental health problem can benefit from therapy. But for many people, it can be helpful to have a name for what you're going through. Labels are there to help you, not limit you or keep you in a box. With the right diagnosis, it can be easier to find helpful information online, to get the right kind of treatment, and to connect with other people who have had similar experiences. So, how do I find out what I have? Sometimes people can get a good sense of what condition they might have from reading about it online and talking to people who have had similar experiences. But it's easy to get carried away. Ever use WebMD to check your physical symptoms and come away thinking you must have some rare disease? Mental health conditions can be the same way. A good starting point is to take a mental health screening test, and we've included one at the end of this chapter. You can use your results to start a conversation with your friends and family, and to monitor your progress over time. Eventually, if you want to be officially diagnosed, you'll need to meet with a doctor or therapist.